This is number 30. Good afternoon, everyone. Thanks for joining us. We've been hovering these last several weeks at about 200 active cases. Only one individual, and of course we feel for that one person, but one individual hospitalized now with COVID-19, and we've held steady at 153 individuals who have succumbed to the disease over these months. We track recoveries, 4,082 individuals identified as recovered, again without really confronting the disease before. There's no defined recovery other than people have sort of outlived the symptoms and the quarantine period, and we're at nearly 4,100 individuals. Just as a reference, we added the regional percentage positive rate. We refer to this as the transmission rate. It's not truly a transmission rate, but it's the metric that the state uses. It's good. It's basically the percent positive against the number of tests conducted, and we've been hovering at about 1%. Now, I do want to mention earlier this week we saw we've hovered these last several weeks at only a handful of new positive cases a day. 2 weeks ago, we saw something in the neighborhood of 39 or 40 positives on one given day. We explained that nearly, about a third of those were false positive. That's not no worry about conspiracy. This is the way the system works. Sometimes there's human error. We identified those immediately with a nursing home who responded quickly. We identified that those were in fact false positives, and we removed them from the metric, from the dashboard. Yesterday or the day before, we saw another slight increase, I think about 14 cases. Just as reference, half of those were inmates at New York State prisons. And as a reference, the Department of Corrections in New York State has been conducting ongoing testing at prison sites. I don't know the protocols they use to make those decisions, but they are testing more aggressively, which means you're going to see those results come out over the course of the next several days. So there may be days where you see a bit of a jump, as long as they're obviously healthy and they're isolated to those facilities. We don't have a community spread concern. But about half of those were inmate related, and the other half were community transmission, almost entirely among family members, and that's good news in that it's contained. But 1% transmission rate or positive rate, that's important. As you know, the state has decided that if we stay below 5% in the region in transmission, schools can begin the process of reopening, and once reopened, if we stay below 9%, schools will hold open. We'll talk about that in a minute. Steve Gleiner, you were once the general manager of the Hudson Valley Renegades, and then you left us.
I did.
Where did you go?
I was in Fort Myers, Florida for 13 years.
Yeah.
And had the opportunity to come back in 2017. One of the best decisions I ever made. It's great to be back here in Dutchess.
Well, we're happy to have you back at the Renegades under obviously some difficult circumstances. Now, this is your, what year again? Third year back since...
Fourth year back, actually.
So you've actually seen a couple good seasons, and you saw a championship season, if I remember.
First season back.
Yeah.
I was given a lot of credit for that, although I had nothing to do with it.
Yes, I remember being out in the field. There was some open container issue. I remember champagne splashing everywhere. And,
got to do the right thing when you win a championship.
Yeah.
You never know when you're going to get another chance.
I will tell you, it's one of the things that I mean, you know this, I think most folks know that I really love Dutchess County parks. I love our parks, from our rail trails to Quiet Cove, Bowdoin, Wilcox. This place is very special to me for two reasons. One of my favorite parks. On any given night, usually there's 5,000 people here enjoying baseball.
Sure.
I love baseball, and I happen to love being around people. The other reason, of course, is I met my wife here, and you know that. And she worked for the Renegades some years ago. And before that, like you, worked for another team, worked for the Richmond Flying Squirrels, the San Francisco affiliate. And she worked with most of the then, 5 years ago, San Francisco Giants World Championship team. So I've got this affinity for Dutchess Stadium. But we're here today for a couple reasons. One, obviously to recognize that we're not going to have a baseball season this year. And as much as I'm looking forward to as many games as the Mets can play, we don't know what Major League Baseball is going to look like as things have happened. But you've found some creative ways to keep the stadium living and to bring people in them. Today is the second day of bottom of the ninth.
That's right. Our bottom of the ninth is part of our camp series, and it's a really cool event. the opportunity for some graduating high school seniors to play in another game as a group, and along with other skills and things that they're accomplishing out there. But yeah, we're doing a lot of baseball camps this summer. On June 29th, New York State allowed camps to restart again. So we figured that was the best way to utilize the ballpark for this summer, since we weren't going to be able to play baseball. And unfortunately, minor league baseball, the season was basically ended before it started this year. We had held out hope that we might have the chance to get games in this year, but unfortunately it didn't work out that way. So we've done a couple of camps already, and we still have a few more on the docket. So if everybody out there wants to check out what we have still planned for the rest of the summer, renegadesbaseballcamps.com. You can call us here at the office, 838-0094, of course, 845 area code.
Do that one more time.
So here at the office, 845-838-0094, or you can go to renegadesbaseballcamps.com.
Great. So bottom of the ninth, a great opportunity for high school seniors to play one last game. I noticed as soon as I got here to the stadium that you have put in place a lot of safety precautions.
Yes. We actually worked real hard very early on to come up with a COVID-19 readiness plan. And we were able to put those plans in place to do these camps and this event here. So it's very important that we make sure everybody who comes out to Dutchess Stadium feels that it's a safe environment and that we're doing everything we can to keep them safe. So that's very important to us.
No, and we appreciate it. And you've been great partners, as you likely know. Dutchess County owns Dutchess Stadium. We rent it to the Hudson Valley Renegades and the Gold Clang organization. We've had a great relationship. When you left here, we didn't have all these nice amenities. We had a regular old grass field that was flooded half of the time. And when you came back, you helped us steer through some improvements to the stadium. Why don't you give us a quick verbal tour, and then we'll let you go on your way.
No, and we really appreciate the relationship with Dutchess County and the support, not only from the county but from all the people who come to games here throughout the season. All the seasons we've been here, 26. This would have been our 27th season. So a great history with the Renegades. But Dutchess Stadium opened in '94 and needed some upgrades. And through our partnership, we were able to go ahead and last year change out all the seats in the stadium, which really brings it to another level. The types of seats that are here now, the level of comfortability for the fans who come out to games here. Really a tremendous upgrade. And in regard to the field, you mentioned that was in 2014. I wasn't here for that, and I have to tell you, I'm a little bit of a traditionalist. When I first heard that Dutchess Stadium was going to have a turf field, I was a little like, oh, okay, this is different. But coming back, I mentioned I was in Florida for 13 years. I pulled a lot of tarp in Florida. Anybody who knows Florida in the summertime, it rains an awful lot. So I like the turf field. I'm a big proponent of it now.
Well, and one of the problems here was if you had 1 hour of rain, you likely lost
pretty much done.
Yeah, you lost the game. And if you had 2 days of rain, you lost a week of games.
This field can take 4 inches of rain every 30 minutes.
Yeah.
That's how well it drains.
Yeah, we don't need to test it, though.
No, believe me. The less it rains, the better on game days. That's
so if even if somebody isn't necessarily coming for the game, I mean, as long as you're open, right? Folks can work some. I mean, can somebody come in to watch the game or not? These that are going on, and of course, concession and stands and shops are still open.
Yeah, and we're doing. Our shop is always available, whether at the stadium or online. And when we do have things going on here, we do have our concession. We have one concession stand open right now for what we're doing right now. That works. So the amenities are here, and again, some of the other things, the new backstop netting, new sound system. We put our new video board in 2017. So really, a lot of great upgrades to Dutchess Stadium over the last few years, and I think from a fan experience perspective, the fans that come out really appreciate all that. And right now the parking lot is being completed.
Yeah, we are. And thanks to the county legislature, we got the resources to do the seating upgrades, and the parking lot will be upgraded. All necessary. Fan experience is important. It gets people to pay for tickets and buy stuff, and when they do that, we all benefit. Right. It's going to be a tough year. I know it is on you. I don't know if folks know, but the Hudson Valley Renegades, between full-time and part-time staff, generally throughout a full season can see as many as 1,000 people working here one way or another through camps and what have you. I don't know what the regular game night staffing is. Do you recall offhand, part-time, full-time on a game night?
Yeah, it's a few hundred individuals that work here on a particular game, on a typical game night.
So think about that, and of course we recognize the failure to have that season. We understand why. Believe me, we all understand the health risk. but a real impact not only to the economy but to those individuals.
Absolutely.
So you guys are great partners. Send our best to everyone in front and behind, except for Rick Zolzer. He doesn't need any extra ego fluffing
He gets plenty of recognition.
Yes, in fact,
Zolzer's great.
it's the only downside of the better sound system. You can hear him clearly.
That's right.
Yeah, and but other than that, we love Rick. So we appreciate it. We're going to hang out for a little while longer. We've got some more stuff to cover, and you're free to get back to work.
Thank you.
You bet.
And again, we appreciate the relationship with Dutchess County and everybody here. So
Well, keep at
thanks
it.
very much.
Let's hope for another season. It's sort of like a little bit like Field of Dreams. No matter what, baseball finds a way to roll on and to continue. It's just not going to look the same way this year.
Something a little different this year, but we're raring to get back, so
Yeah.
we can't wait for 2021 to come around.
Yeah, you and me both.
In
Okay.
a lot of ways.
Thanks very much.
Thank you, Mark.
Thanks. Let's go
Appreciate it.
Gates. Thanks, Steve. So I wanted to give you an update on where we are with Phase 4 activities, and that is to just right up front let you know that still no updates on gyms, theaters, or indoor wedding venues. So I know that that's always a question that gets asked. We have pushed, believe me, there are very few people who want that gym open more than I do, but we are working with our gyms to be creative. Some are functioning outdoors. Some are using studio space within their gyms to provide certain programming, but the state still has not provided guidance on gyms, no guidance on theaters, and still no guidance on indoor weddings. Now, we've made the argument that an indoor wedding facility with strict safety precautions is safer than having a few hundred people in one's backyard for a wedding, but the state still has not made that clear, no guidance there. You likely know that just 2 days ago, Splashdown here in Dutchess County announced that they would not be open this season. This is a real, real heartbreaking closure. I know that everyone's experienced a lot and every business has experienced a lot, but you understand if you own a pool, you know in New York there's only a few months out of the year you can even make use of it. Well, imagine investing millions of dollars in a facility like this and having to close. Now, I do want you to know that we made the case that water parks could function safely. We made that decision with our public health officials. We were monitoring the activity of water parks in Ohio, New Jersey, and Connecticut. All have been open for several weeks and several months. There are safety precautions that would have had to be taken, and you wouldn't have experienced it the same way. But the Turk family was investing in making sure that Splashdown would be safe. And sadly, even to this day, the state still has not made any guidance available or direction on any direction on water parks. So they're not opening this season. If you have a question, remember to write it in the comment section below the live feed. And as we do that, I'm going to invite a friend of ours, Senator Sue Serino, is with us. Senator, why don't you come on by? I'm going to don my mask as well. For two reasons. I know you're going to say, well, you didn't wear one when Steve Gliner was here. And it's not because Steve and I are close enough that we wouldn't share germs, but you are going through some health challenges. And we thought since you were going to be here with us here at the bottom of the ninth game that today would be a good opportunity for us to have you join us. So I'm going to wear my mask. This is actually a New York Mets uniform. Donated by the New York Mets. I am a Mets fan so far. We've got a decent season that may or may not conclude in 50 more games. It could conclude in a week for all we know. But you're wearing a mask with a pink ribbon on it, and why don't you tell us why?
Okay, thank you, Marcus. Yeah, in fact, it says Serino Strong.
Ah,
the
nice.
girls made it for me, which
Nice.
is great. Well, back in May, I was diagnosed with DCIS, breast cancer. And I'd gone for my mammography in February, and as we know, COVID hit in March. They saw something in February, and I was supposed to get a biopsy, and they had to cancel it. So when everything opened back up, thank God I had that little feeling to go back and make sure I got the biopsy done. And May 13th, they gave me my diagnosis, and had my surgery in June, and I'm going through radiation. 13 days down and 7 more to go.
Nice.
So-
And how you feel?
Now I'm getting a little tired.
Yeah.
That's what they say, you get a little tired, but it's okay. So I take my rest when I need to, but I'm, as you know, going every day.
Sue Serino Strong, nonstop.
Yeah.
Yeah.
So.
Well, I know, and we've talked about this a little bit as well. Listen to that little voice, right? If you're feeling a little bit unusual, uncomfortable, you could be dealing with COVID,
Yes.
but you could be dealing with any number of health-related issues, and now is not a good time to ignore that.
No.
And I know that you've worked with our hospitals and healthcare providers. They're trying every day to make sure that people understand that it's important to schedule and to be concerned about your own health.
Yes, it's and when you think about it, look at how no matter where you go now, everybody is wiping everything down as soon as you leave. The hospitals were always clean, but now think about how even cleaner, if that's a possibility.
Yeah.
Because in between patients, they're cleaning everything. So people shouldn't put off a diagnosis or an exam, a health screening. They need to go now. My story is a perfect example. My doctor said even if I would have waited a couple more weeks, my prognosis would have been so much worse.
Right.
So.
Well, you have a good structure. I know that you have a good family that's around to be a help.
And friends.
I was just, no, yes, don't count. I mean, listen, I'll be helpful, but I'm not as reliable as some. No, that's not true. Although, if you really want to get help, you call my wife.
Yes.
Corinne will be right there. But you also, like I do, support a number of organizations that are in the community being helpful. Or any on your radar these days?
With regard to breast cancer?
Yeah.
Oh, Sparrow's Nest.
Yeah.
Krista is just amazing, and her team is unbelievable. They provide meals for people. They surprised me with providing a meal for me, and you think that, I don't need it, but then you're tired, and boy, it really helps. And also Miles of Hope. We're very fortunate for all the organizations that we have in our community that the resources are out there for people.
Yeah. Well, I know when you're an elected official, which I've been actually longer than you have.
Absolutely.
But that said, people always wonder, well, why are they telling this story? But you were very clear that you wanted to share your story just as a motivator for others to pay attention to their own health, and I think that's important.
Yeah.
Yeah, and they should.
That's what it's about.
Yeah.
Right? Because I was one of the people that used to put off my mammography, and thank God this year I did.
Yeah.
So.
Good. Well, hang around for a minute. If folks have questions, just write them down in the feed underneath the live stream. I know that you're working every day in Albany and throughout the district. I think you and I both know there's a great deal of frustration regarding unemployment and access to unemployment. You want to talk a little bit about what your staff has been doing, and then remind folks how they can be in touch with you if they have any issues that you can help with.
Oh, absolutely. Our team, my team, you can't do this on your own, right, Marcus? We have great teams, and they've been wonderful. My staff has been calling so many people back, hundreds and hundreds of people through the course of this pandemic. Some had gone a few months without even getting a check. So we've helped them, helped many, many people, and it's so important that people call our office. It's 229-0106, or they can email us at sereno@nysenate.gov and let us know, and we'll help them out. And small businesses have been contacting us, as you were mentioning right before this, the frustration that's going on. And I think one of the biggest frustrations is there's no plan.
Yeah.
Right? For, like you said, the gyms and the theaters, and like Steve Turk with the Splashdown.
We've said it. I mean, listen, we understand the safety concerns. Believe me, I certainly know the health toll. I understand it. We've just said to the state, you've got to be clearer with businesses so that they can make decisions. For instance, if you really just don't think, I'd almost feel better if the governor just said, listen, I don't have a good feeling about water parks. We're not doing them this year. Had that happened a month ago, or even 2 weeks ago, you could be in a position of saying, listen, we're going to shut it down. We're not going to spend the money. But leaving it up in the air means businesses, some who either have the resources or are desperate to get open, or spending money preparing, and then they're waiting in this limbo. And it sort of is, it's sort of the same thing we've said even about, the food with drinking.
Yes.
I understand that the outcome is we want to lessen the number of social gatherings, right? Small groups. We don't, but eating isn't going to keep you healthy.
Right.
The message should be very clear. Just don't have big groups,
Right.
not
practice safety.
Absolutely.
Like we do.
Oh, yeah.
Wear a mask.
Absolutely.
And that's why we're doing so well.
We are doing
Duchess
relatively.
is doing great.
We're getting there, and the
Yeah.
Mid-Hudson region has been seeing progress. Well, Craig asked a very pointed question, so I'm going to ask it. But I think you're ready for it, which is, the concern that a lot of people have about the emergency powers that were granted to the governor.
Absolutely.
And how they can be sort of balanced again. He asked how can you roll back those emergency powers? But you all have been talking.
Tried.
Go ahead.
We've been back to Albany 4 times, and have asked. We've put bills forward to be able to take the powers back from the governor, and the new majority will not do it.
Yeah.
And when you're elected, and as you know more than anyone, Marcus, you have to make tough decisions, right?
Mhm.
I don't know if it's that they just don't want to make those decisions and they let the governor do everything. It's just not right. We have to go back to a legislature that we are supposed to be.
Yeah, there needs to be the balance. The other is, people I think need to also understand, New York State already gives executives a great deal of authority. New York State
Yes.
executive law provides in a state of emergency, people like me, mayors, the governor,
Yeah.
an enormous amount of authority to affect change. What the state legislative majorities gave were sort of extra powers, the ability to kind of craft law. I never thought that was necessary because we already have a great deal of authority to kind of deal with public health risks. So keep at it. We know that at some point there needs to be that restoration of balance. The other, I'll tell you locally, one of our concerns, of course, is with the enormous budget authority given to the governor.
Yeah.
He may be making what you and I are calling temporary cuts, but we also know the way this state has functioned. They may make a temporary cut to local aid, to not-for-profits, or to local governments, that become permanent, and that's always
Right.
that's a concern that we all have.
Once they take it away,
Yeah.
they typically don't. give it
Except
back.
taxes, they
Yeah,
seem
oh,
to
yes.
be very careful in never taking away taxes. Although we took away one in
Yes.
Dutchess, it was a big. We took it away.
Yeah.
So a couple one question. Donna asks specifically, is Sparrow's Nest local? And
Yes.
why don't you talk a little bit about what they do again? Yeah.
Yeah, Donna, Sparrow's Nest is local. They're actually located right in Hopewell, and they serve 4 counties.
Right.
It might even be larger than that.
It may be, yeah.
But you can go on Facebook or social media. I have Krista's cell phone number. If anybody knows somebody that needs help, they can call our office, and I'll be glad to give that number out.
Great.
For her, because I met some women today that are going through chemo, and they are, oh my gosh, Marcus, when you see them, they're just so weak.
Yeah.
And they didn't know about Sparrow's Nest.
Yeah.
So I took their telephone number and passed it on to Krista. It's a great organization.
And they welcome volunteers who cook meals, so there's
Yes.
opportunity for you to donate and to volunteer.
Probably donate now, because right now,
Oh, of course.
because of COVID, they've kind of limited who's actually taking care of the food. From what I understand from
Yeah.
Krista, I don't know if they've expanded on that yet, but they could always use donations and help in the future for sure.
Great. Well, Debbie wanted us just to say Sue and her staff. I mean, this is clearly a relative of Sue Serino. Sue and her staff helped my husband get unemployment after 8 weeks, so thank you.
Yeah.
Debbie wanted us to say thank you.
Oh, that's good.
And I appreciate that your staff paid her $5 to say that. No, I'm kidding, Debbie. Ron Hicks has worked with your staff. Of course, we
Yeah.
work with all of our legislators locally. We've had great response, so I don't want to disparage or discredit everyone. Every one of you have been trying to assist us these last several weeks in making a connection for constituents. So we're grateful for that. So if you have a question, write it down in the comment section below the live feed. But Sue, if you want, I know that you have a busy schedule. You're out and about, and we don't want to keep you. So stay strong, and thanks for
Thank
coming
you.
in today.
Thanks for having me on, Marcus.
You're welcome. Thanks.
Okay, I'll talk to you soon.
Be well.
Thanks, everybody.
Thank you. So we appreciate Sue stopping by. I feel like these days, every Wednesday, we've been introducing a few new faces. Last week, we had Dr. Wythian and Allie Smith. Allie is our epidemiologist. Talked a little bit about some of the public health concerns. What we'd like to do either next week or the week after, hopefully you'll see some of our infectious disease staff, those who work beyond what Allie does, some that work with our contact tracers, and do some of this sort of contact reconstruction along with the folks who have been leading the public health response. So we'll have a few of them on with us to answer a few of your questions next week. So if you have a question, ask it in the live in the comment below the live stream, and we'll be happy to get to it. Lori asked if gyms or bowling alleys are open. The answer is no, neither are open. Believe me, my uncle Dulio is a bowler, and I don't know where he bowls, probably Connecticut now, but currently still no guidance on bowling alleys, gyms, theaters. I also want to reference that due to an increase in transmission rates, The travel advisory has been expanded to now include Illinois, Kentucky, Minnesota, and Washington, D.C., and Puerto Rico, which I appreciate that they wrote on the notes are not states, because, I would never have guessed that Puerto Rico and Washington were not states. But that said, I'm kidding. It does say it, though, just in case. But we're now at 34 states and two, is that right? 34 states plus the city of D.C. and Puerto Rico. And again, the expectation under the state guidance is that if you travel to one of those states or travel from one of those states, you are required to submit a form to the Department of Health, the New York State Department of Health. You can find that form online. Failure to submit that form could come with as much as a $2,000 fine. That's the state expectation. And remember, if you have traveled there for a period of time, or you're traveling from there back here to New York, Connecticut, or New Jersey, you are required to quarantine for 14 days. Now, interesting, I think we had a question yesterday on social media. If somebody's traveling from another state, comes to be with you, it is, quarantining is actually separating yourself from everyone else. So if you're socializing in close proximity, it is likely important that you consider being tested at some point as well. Just again, the state guidance is if you've traveled to any one of those states and returned, or traveled from any one of those states, Puerto Rico and the city of Washington, D.C., you are required to fill out that form and to quarantine for 14 days. Mike asks about updates regarding the Arc of Duchess, her Abilities First Day programming. Those activities can commence, but it really is up to the agencies to make those decisions based on what safety steps they want to implement. And some are able to meet those expectations, some are not, and have decided that they're not necessarily expanding. But we'll continue to advocate for those services. Again, we think it's very, very important. Probably a good opportunity to also remind you that we are working with our local school districts. Dutchess County Department of Behavioral and Community Health staff have been providing counsel and guidance to all of our school districts. We're very grateful to Dutchess BOCES. Dr. Richard Hooley has been attempting to coordinate the school district conversation. I am not necessarily privy to every school district's expected plan, but we are providing them basic guidance that needs to be submitted to the state of New York by the end of this week. And then the state with school districts will begin making reopening planning decisions at the end of next week, or basically the first full week of August. So you'll start to see what school districts are planning. The goal has been to try to provide as normal an experience as possible, recognizing that there are vulnerable populations both in the student population and that work at school districts. Critically important, those who work at school districts could have vulnerabilities, and that's something that needs to be considered with school district reopening, and we're working with them on that as well. Denise asked if I have any idea regarding visitation at the Dutchess County Jail. Under Sheriff Kirk and Parati and I spoke this morning. They are attempting to restart public visitation, in fact, August 1st, which is Saturday of this week. But that has to be first accepted by the Commission on Corrections. So if I'm betting, the New York State Commission on Corrections, if I'm betting, I would suggest that reopening and visitation at the county jail probably wouldn't necessarily begin full speed until next week. But right now they're saying August the 1st is their tentative date, and if that is to occur, they will issue a public statement and more information about that. And of course, we'll share it on social media for you as well. So right now, in fact, right now, as we speak, Congress, both Republicans and Democrats in the United States Senate and in the United States House of Representatives are debating the next response to COVID-19 and the pandemic. As you likely know, the federal government has provided a great amount of resources to individuals, including unemployment and unemployment bonus, assistance to some small businesses, rent assistance, and so on. But we clearly recognize that not only in New York, but now certainly states across America, there continues to be an enormous challenge for businesses, families, and local governments to continue to function. So they're debating now what the next package of assistance will look like. We are asking states across America and county governments across America, Republican and Democrat, rural, suburban, and urban, are asking for federal assistance. And I know some of you watch this, and of course we try to respond on social media, and you scoff at this. Yes, the state of New York was sustaining a deficit, in fact an operating deficit going into COVID-19. Yes, state government has a huge amount of improvements to make in the delivery of services and the use of funds. But these last several months have caused great damage to state and local governments in the substantial loss of revenue. In particular, local governments like ours rely principally on sales tax. Sales tax represents 40% of Dutchess County's budget. Just as a reference, our second quarter sales tax for the shutdown period, so from March 1st to June 22nd, is down 17% this year from last year. So our year-to-date loss is about 11.5%, currently at about $10.5 million in sales tax losses. We expect that will continue and that we will sustain as much as a $40 million loss in sales tax revenue. Now, I know some might say, well, you guys should just tighten your belts, and we are. We furloughed a good number of employees to save some dollars. We froze new hiring in almost every case. We restricted spending and cut spending in a number of areas, and we are in the process of offering an early retirement incentive to further restrict the county, further shrink the county workforce. We are taking every step necessary to save every dollar we can, but there is no amount of cutting except the outright elimination of core services that you and I rely on, like snow removal and law enforcement and 911. These are the services that aren't mandated by New York, but we have discretion over. They would see significant reductions if we cannot either recover those revenues or are provided assistance from the federal government. And just as a reference, and again, I recognize that you don't all agree with this, but this is the way emergency response works. When there's an emergency, the first responders are the first responders. You see them, police officers, firefighters, paramedics, go to the scene. When they get to that scene, if that emergency is bigger than they can manage, they bring in mutual aid. In fact, the county government monitors and manages that mutual aid system, and we dispatch through our public 911 system, public dispatchers. If that emergency grows beyond what can be provided for among several agencies, well, then several levels of government step in, and so on. And as the emergency grows, other levels of government come in to provide assistance. That's how we respond to emergencies in America. It's how we respond to snowstorms, tornadoes, hurricanes. It's how we handle fires and floods, and it is how we handle public health crisis. In a public health crisis, which this is, now facing so many states across this country, so many people, public health departments administered by 1,900 county governments across America are responsible for that response. So we're out there responding every day. Our staff, our people are doing everything we can to respond to that. At the same time, right, we're obviously having to run government. And the loss of revenue has been significant. We need the federal government to assist us. And no amount of finger pointing by you or me or politicians is going to make that go away. We are not going to magically recover $40 million or $50 million in revenue losses. It's not going to happen. We will not be able to just magically make that up. And so what we've been asking for is flexible aid from the federal government, which the federal government often provides in case of emergency, that will bridge the gap between our losses to when we restore economic activity. And we expect that it's short term. We expect that by this time next year, again, assuming we've taken on the challenge of controlling the public health risk, that we will have recovered. So we need the federal government's help. As a reference, revenue for hotel and motel tax down 80%. It's $1 million lower this year than we were at the same time last year, down 80%. State aid reductions because of the loss of revenue at the state level, 20 to 50%, which could provide us as much as additional $42 million loss in assistance. And we're seeing in casino revenue, we get shared revenue from area casinos to be $1 million under budget. This is all critically important if you expect us to provide services. And by the way, those sales tax receipts, that revenue is shared. 18.5% of that is shared with towns, villages, and cities across Dutchess County. So they're facing the same kind of burden, although not as extreme, but the same kind of burden the county government is as well. I like that. So we need Congress's assistance. And what I will tell you is the House of Representatives and the Democratic majority did adopt, with Republicans fighting side by side, the HEROES Act. And yesterday, the governor said something, and I'm going to reference it. Republicans in New York State, House of Representatives, Republicans and Democrats have been working together to try to advance assistance for local governments. There's been no room for that kind of squabbling at this level here in New York. We know this firsthand. I will tell you, the Senate majority in the United States Senate, a Republican majority, has yet to come to the table with a bill that provides state and local aid. State and local governments pay for law enforcement. We pay for emergency response. We pay for 911 services. State and local governments pay for public health response. We are the first responders. We're the ones that are providing assistance when the federal government has aid for small businesses. We're the ones that are advocating for unemployment assistance with our residents. We're the ones that will see you at the grocery store to try to respond to your concerns. We need the federal government to step in. There is absolutely no alternative. And never in the history of America has Congress abandoned its state and local partners in an emergency response. So this isn't some game, and it's not us trying to finger point, and this isn't there isn't time for politics. And if you're looking for it, I suggest you turn off the Facebook feed and watch something else. Because at the end of the day, our job here is to do our job. And that is to provide direct care, direct services. We have one job, and our one job in this government over these last several months has been to provide for public health and to rebuild our economy and to rebuild our community. That is the job that we have. We cannot do it with significant losses, and we need the federal government to help us. And it is politically craven, and it is cowardly, and it is selfish to think that the federal government doesn't have an obligation to assist local governments in getting off the ground. And we will get off the ground. We will get back to where we were, but we need that help. And so in these last few days, please ask your members of Congress, your members of the U.S. Senate, and if you have friends in other states, ask them to do the same. Urban, rural, suburban counties across this country are dealing with this challenge. And this is not a time to play politics with people's livelihoods and life. And we're trying our best to respond as effectively as we can. So, at the moment, there is no resolution on extension of the unemployment benefit. There is no resolution on state and local government assistance. But we do expect Congress will come to a conclusion later this week, and we could use your assistance. If you have a question, write it in the comment section below the live stream. We'll get to a few more. Just as a reference, so one of the things that we did participate in this week, Senator Serino, who was here, she and I, along with Mayor Rollison, Assemblyman Jacobson, and members of the county legislature, working to support efforts to support child care. We already know that access to quality child care is a challenge under these last several weeks and months. Accessing quality child care has been an insurmountable challenge for too many. Child care providers stressed as, in essence, essential first responders. As we reopen and activity gets back to work, if schools are going to stay open, and their families are going to get back to some semblance of normal, we need child care up and running. We've asked the federal government to step in and provide assistance. Senator Gillibrand was here to advocate for a bill that does have bipartisan support across the country, and we are hopeful that we can provide some aid and assistance to child care providers. One of the things that we'll be talking a little bit more about in the next couple of weeks is actually support for child care at the county level, and we'll have some more information about that as we get further into the month of August. Just as a reminder, the federal government and the state government expanded access to rent relief. So for individuals who are low-income residents who are deemed rent-burdened by COVID, very clear application process. It is not ours. It is the federal government and the state government. We're administering this program. Applications must be postmarked by tomorrow, July the 30th. We have folks who are assisting, rent navigators, and staff who have been assisting in getting those applications completed. So if you have any questions, you should reach out to us. Visit duchessny.gov. search our website for rent relief. In fact, if you type in rent relief in the search field on the county's website at duchessny.gov, the very first item that pops up should be more information that will provide you access to that application along with contact information. So feel free to do that. They're very specific protocols not established by us. We'll help you navigate them and to be of some assistance to you. Yesterday, kicked off our very first drive-through senior picnic. It was a great success thanks to the Office for the Aging staff. We're grateful to Senator Serino and Assemblymember Barrett, who sent staff and goodies, if you will, to be distributed. But our very first picnic was in Pleasant Valley yesterday. Our next senior picnic is tomorrow, Thursday, at Beacon, the city of Beacon, July the 30th. If you're looking for our full schedule, visit duchessny.gov. Duchessny.gov is the box here. Duchessny.gov. And you'll see the full schedule. We're having these drive-through senior picnics every Tuesday and Thursday through September 3rd. So we're doing our best to provide assistance. We were buying our lunches from area delis. Yesterday, I think, was the Corner Deli in Pleasant Valley. But we made a substantial local purchase, and we're doing that in each of the communities, along with milk from Hudson Valley Fresh. You can look them up. And dessert is fruit from an area farm. So please, if you're a senior citizen, there was an opportunity. Invites are still going out, so if you haven't gotten one yet, you might, and you should. And please feel free to register so that we can get you on the list and get you in. But great opportunity for good lunch, and we'll wave at you as you drive through. Sharon asked if Dutchess County schools are going to be open in September. So the state guidance is every school district crafts its own reopening plan. The county has been assisting, as well as Dutchess BOCES, assisting local school districts in developing those plans. With the expectation that they'll have those completed by the end of this week. They'll all be slightly different. We're hopeful there's some uniformity among them. Certainly how you respond to a positive case or testing or quarantine issues, those should be consistent. We're providing guidance there. But each district is making some very unique decisions based on their needs and goals. But I will say the state's expectation is we start from the desire of getting students back into the classroom. They're not starting from the perspective that kids should stay home. They're starting from the perspective that kids should get back into the classroom. And then the question is, how can that be done as safely as possible to respect the health of the students, the health of their families, and the health of staff? And that's where they are. They're going to have those plans done by the end of this week, and we'll know more next week, and likely get you updated when we see more information. Robert asks, have I spoken with Ulster and Orange about having them urge residents to reach out to federal reps about funding? The answer is yes. Every county in New York State is advocating. We here in the region advocate together. Steve Newhouse, Pat Ryan, Ed Day, George Latimer, and Mary Ellen Odell from the surrounding counties and I all work together. We've been advocating for federal aid. We're asking our residents to do the same, and you'll have seen some media lately. We're coordinating with our local members of Congress and others to make that case, and you should do the same. And you'll see on the screen the contact information for at least those who represent Dutchess County in the House of Representatives and, of course, New York State in the United States Senate. If you have any additional questions, please write them in the comment section below. We'll try to get to a couple more. Alyssa asks, how is the travel ban monitored? Is it self-monitored only? Well, the short answer is sort of yes, it's only self-monitored. The state of New York expects that you are going to follow the rule and fill out that form. Once you fill out that form, health departments like ours will attempt to contact you. The state health department will attempt to contact you, but it is somewhat self-enforcing with, basically auditing, right? So they might check in from time to time. They might pull and see if you fill out that form, whether or not you're honoring the quarantine. But yes, you're correct. If you don't fill out that form, it's hard for us to know whether or not you've traveled. I can tell you that we, if you come back and you're posting on Instagram your pictures from South Carolina, one of the states, I'm sure it is, then it's going to be easy for the state to figure out that you were traveling. This isn't no one's trying to be a snitch here, and we really do appreciate that, everyone has to live a life. We want to be sensitive to everyone's differences and differences of opinion, but we're all trying to just get through this together. So keep in mind that, we've even had family members say my cousin, or some have said their ex-spouses have traveled to locations. So we're trying to be sensitive to it. We ask you to follow the expectation, and we'll help you figure out what those rules are. Do you think children will choose between in-person or virtual? Madeline, that's a good question. I think that school districts are going to start again from the perspective of having to get as many students back into a classroom, but then recognize that some students will have reasons why that wouldn't make sense, and likely will give some the opportunity to make that choice. But again, every school district will have its own reopening plan. We're just trying to provide them basic guidance, so they're using the same information to come to whatever conclusion they come to. But I do think that the goal is to try to get students back in classroom. So the goal is to try to get students back into the classroom, and the school districts are attempting to make that work, okay? But we'll know more as we get into next week. Diana, any inkling as to when large gatherings will be more than 50? The answer is no. I don't have any inkling. I wish that I could provide you some better insight. The state is holding at the moment at that 50 number. Keep in mind that's 50 for social gatherings, but a facility, an outdoor arts facility, an aquarium or a museum can have a third capacity. Churches can be at 50% capacity. Restaurants are at 50% capacity. But you're correct, currently 50 people or less for a social gathering, and we'd ask you just to try to conform to that as best that you can. But no inclination on when the state might increase that. We have our calls every day, and I'll tell you that we aren't getting any new information of late. We'll continue to advocate for guidance. As we said with Senator Serino, it would be just nice to know deadlines and dates and expectations so that we can all at least begin to plan. Even if those plans had to change, we think it's better to be very clear on some of the expectations and then go from there. But right now, it's been very, very great. If you have any questions, write them in the comment section below the live stream. So we are here but we're live with you every Wednesday. We're going to continue to do that through the month of August. We're scheduled for next Wednesday, August the 5th. So we want you to join us then. Wednesday, August the 5th. And at the end of August, we'll have our telephone town hall, which is very successful. I was very happy with the turnout and response. So we're doing those once a month to give folks an update, both telephone and on Facebook. Eileen, why did our numbers go up so much? Well, so much is relative, but I will get back to what we said before. So last week, we did have a spike of about 38 or 40 cases. 1/3 of those cases were inmates at state prisons. There are a good number of state prisons in Dutchess. The Department of Corrections, New York State, has been conducting testing. You're going to see those numbers come in. So 1/3 of those were inmates at state prisons here in Dutchess. 13 or 14 of those were actually false positives identified at a nursing home. We immediately responded, and our team working with that nursing home identified that they were false positives. It was, in essence, a human error at the lab. They were pulled out of the data point. And the remaining third, which put us in about 7 or 8, maybe 9 cases, which has been about what we've seen, it was standard community transmission, which we've seen. Yesterday or the day before, I think our cases went up by about 15 or so. Half of those were inmates at a New York State prison. So the other half, 7, were family transmissions, transmitting the disease among family members. No widespread community spread. So I will tell you that we're not seeing a trend that concerns us. Our public health department continues to monitor our cases. Transmission rate remains at 1%. And we're hovering at that single-digit community transmission day after day. And if there is a reason for us to be concerned, you'd know it. We would advise. We had an instance last week with one area business. It was handled entirely correctly. A lot of good, quick response by the health department and that particular business. We publicized at least the concern, and that was at Ashley Furniture in Poughkeepsie. They've remedied and responded well, disinfected, cleaned the facility, closed down for a short period of time, updated their safety planning, and notified staff and customers who may have been there during the time at which an individual was exhibiting some symptoms. Did the right thing, but if we felt there was a public health concern, we would let you know. As a reminder, we're encouraging you, if you have perhaps come into contact with someone who's transmitted the disease, you'll want to be tested. If you're feeling like you may have the disease yourself, you want to be tested, and be aware of that as well. Access to testing is widespread. We're at about 87,000 tests conducted in Dutchess County these last several months, and we'll continue to ensure. Gianna, what are schools going to be doing with surplus of money from this year? Will taxes go down next year? Well, first, when you say surplus, you've got to keep in mind that everybody got paid, right? And I know that I shouldn't say everybody. Most full-time employees in government and school districts did get paid. So that's an expense that they sustained, whether those individuals conducted the amount of work you wanted them to. I'm very grateful to school teachers and administrators who worked these last several months, but those individuals received a paycheck. So the surpluses, if you will, are offset by expense. And then school districts are currently spending money on preparing for reopening. So if you have a specific question regarding your school district, they're not administered by county government, enough problems, you should reach out to your school board and your school superintendent. But you know the answer to the question. One, I don't know what kind of savings they'll have seen. I can tell you Dutchess County is not going to net savings. We're going to actually be with a significant operating loss. But the hope is that we can overcome them without obviously having to go back to taxpayers. So, that's always useful. So let's just jump in. I like to do that. So we have an individual who's adding some interesting information. I'm going to just respond to it. Please, I don't know who you are, but stop it. I mean, honestly, if you want to go spreading bad information to other people, go ahead and do it. But don't do it on our Facebook page. Thanks very much. I know it's a government page, but we're asking people to be sensitive to one another. And I have to tell you, it's the one thing I can't stand more than anything. Everyone is under a lot of stress. There are a lot of people who lost a lot. My father didn't die because of a hoax, just so you know. You got it? So just be clear that there are a lot of people under a lot of stress. Some who don't know what to believe, some who believe fervently one thing or another, but don't pick at them. And don't use this as an opportunity to bully people. I promise you, it is not the right time to do that, okay? So let's be very conscientious of one another, let's be very considerate to one another, and let's be respectful that we don't all agree. And we're never going to all agree. But it is critically important that we treat each other with respect. And I absolutely ask that you do it, especially while we're spending time trying to update people with community information. Cooperate with contact tracers. If we're reaching out to you, they're not going to probe you. They're not going to ask you for information that isn't ours. It is basically to provide you some guidance. Masks do work. We know that they do. They slow the transmission of the disease. Please wear one. If you have an underlying illness that precludes you from wearing one, please remember that you're under no obligation to express what that underlying illness is. However, it is necessary for you to try to advise a business or an individual that you may not be able to wear a mask and that they are responsible for coming up with some reasonable alternative. Hand sanitizer is not dangerous, whomever you are. It is hand sanitizer. In fact, there's a great study by Purell. If you read it, it was on I don't know, it was one of the news programs, one of the National Geographic was doing a background on Purell. As far as calling individuals cultists, knock it off. We're not allowed to block you, so we're not going to. We respect your right to say whatever you want, but please be kind to the people on this feed. Honestly, it really is necessary to be respectful. It is very infuriating to see people attack one another. It's just not necessary. As I said, a lot of people are dealing with a lot of stress. You've got businesses, whether you think that they should have been closed or not, are struggling to do the right thing and get open. They're getting mixed messages. There are folks who are sick, who need access to testing or need access to assistance. They're really sick, and they're frustrated. There are folks who have lost loved ones and don't know why or how, and there are families with individuals in nursing homes or daycare providers, day-have providers that can't see them. They're living through a great deal of stress, and it's no one's fault on this Facebook page who's commenting. It's no one's fault that they're living through that. So be kind to one another, and please make it simple. So be respectful of one another. It is 4 o'clock. I think I've ranted long enough, but it is critically important, especially these next couple of weeks, that we continue to summon what kindness and compassion we may have. When this is all over, we can look back, we can judge one another, we can certainly take out our frustration at the ballot box. You have every right to, and you have every right to express your opinion. Believe me, I respect that, I accept it. I've been both benefited by that and have been the recipient of that. It is critically important, but it is also important to respect the differences that we have. We try desperately to give everyone an opportunity to be heard. We answer as many questions as we can, and together I'm hopeful that Dutchess County will continue, its residents will continue to summon the courage, the kindness, and the compassion necessary to get through this. So in the meantime, stay healthy, be safe, and be kind to each other.